So in phase one of this video assignment, there were a few things that the nurse could have improved upon in regard to her patient care. One of the first things that I noticed was that the nurse didn't introduce herself to the patient. She didn't perform hand hygiene, and she didn't have any gloves on. She didn't identify the patient by using two patient identifiers. And then in regard to the conversations and stuff later on, she didn't establish boundaries with the patient. So whenever he said, they tell me that I look 39, she says, "Ooh, I agree with that." You need to establish a patient boundary there. Whenever the patient was complaining of abdominal pain, she didn't assess any of the information that he was giving her. She didn't use the old cards mnemonic. She didn't ask the patient if he had any allergies, and she didn't do a medication reconciliation properly. So what medications was he on? Like, how much of them? How frequently does he take them? What are what medications are you taking them for? And he didn't educate the patient about the medication interactions of the medications that he's on with alcohol use either. In regard to phase two of the video sets, some of the things that I noticed that the nurse could have improved upon would be that the blood pressure is being taken in the same hand as the pulse ox is being placed on, and so those two might interfere with one another, causing for improper readings of the pulse ox, especially. Whenever she was having complications with getting the blood pressure, she didn't try to take a second reading of it. She didn't get the patient's respiration rate. She didn't get the patient's temperature. She didn't listen to the patient's bowel sounds prior to beginning palpations on the abdominal area. She didn't put the patient's guardrails up, and so the patient could have fallen. She didn't give the patient his call bell in case he needed anything while she wasn't in the room. She didn't get the patient's pulse, and she didn't listen to each of the patient's heart valves during auscultation of the heart. And she also didn't listen to the patient's anterior and posterior lung fields. In regard to the patient's diagnostics, some of the things that really stuck out to me were the blood pressure, the heart rate, and the respirations being a priority, and also an unknown temperature is a problem as well. Some of the things that I noticed in regards to his lab was that he had a low potassium, he had a high RBC, he had a high white blood cell count, high bilirubin, and then the hematocrit might be considered low depending on whatever scale that you're using for it. But either way, it's probably a little bit borderline. And then the patient is probably experiencing kidney stones, and then so some more diagnostic tests that could be ordered would maybe be an x-ray for the abdomen, or an abdominal ultrasound might be conducted. In regard to phase four, again, there are some things that the nurse could have improved upon in regard to the patient's care. Some of the things that really stuck out to me were that the side rail was still not up. She didn't give the patient his call bell just in case he did need her while she wasn't there, and so he couldn't even call out to say that he doesn't have his call bell. Whenever she was trying to assist the patient back in the bed, she shoved him. That's a big problem. She told the patient that she was going to be in there and that he didn't need his call bell, and that's something that you can't guarantee because you never know whenever you're going to have to leave the room for whatever reason. And she also, whenever she was going to give the patient his pain medication, she assumed what his pain was, rating it as a 10 out of 10. And you can never assume the patient's pain. It is what they say it is. Again, the nurse didn't do a medication reconciliation pertaining to the patient's rights. She didn't have a mask on, she didn't have any gloves on, and she also didn't perform hand hygiene again. She also made a comment about eating snacks at the nurse's station, which isn't okay. She didn't provide the patient with blood pressure education. The 160/78 is not a normal blood pressure, as she kind of indicated that it might be, and so the patient should have been educated on hypertension. Also, whenever she went to go and get the patient's temperature, she should have primarily attempted to do an oral temperature and then tried underneath the armpit, but she went straight for the armpit, which isn't the most accurate reading. So another thing that I noticed was that she also tried to bargain with the patient. So you have to stay in bed or else. Healing shouldn't be a compromise. So she shouldn't have bargained with the patient there. She also made up some of the vital signs because she couldn't get them properly. That's not okay either. You should never assume. She also didn't pay any attention to the pulse rate whenever she went to take that. She checked her personal phone during the patient encounter. She didn't stay and watch to ensure that the patient took his pain pill, so you never know whether the patient is actually, stuffing it like he did in the video, or if they're throwing it out, or if they're giving it to somebody else if they have visitors. She also didn't educate the patient on any of the side effects that the patient might experience because of this pain medication. And again, even if she did have to leave the room for whatever reason, she didn't leave the call light for the patient to reach out if he were experiencing complications like he did in the next phase. And in phase 5, this probably could have been prevented had the nurse stayed in there to make sure that the patient took his pain medication properly and make sure that he wasn't having any complications after taking it. But the nurse waited 3 hours after administering the pain medication to the patient to come in and check on him. So the medication effectiveness should be evaluated within 30 minutes of administration. The nurse also should have checked on the patient shortly after the administration to ensure that they weren't having any complications, because even though he said that it was something that he might take at home, she didn't perform medication reconciliation. She didn't see what kind of allergies he had, and it could have been something different, and the patient could have not experienced the problems that he had. Also, she vocalized her disinterest of the patient in front of him while she was about to enter the room. That's not okay either, because that really impedes on the patient-nurse relationship that they've established, and so they might not be as trusting. Also, the patient's code status should have been known and identified on the armband. It also should have been something that should have been passed off in report. Not being familiar with the patient's code status can cause a significant amount of complications, especially legally, and also since Miss Dirt saw that she was about to start compressions on her husband, who is a DNR. So she shouldn't have started running a code. And if she would have started running a code, if he were a full code, the compressions should have been started right away, and an airway should have been secured, because the patient wasn't able to breathe and was experiencing respiratory distress, and so that shouldn't have been an issue at all. That should have been one of the first things that they attended to, because ABCs. And then also something that I noticed, maybe this is just me and my facility, but whenever you're about to start actively coding a patient, there should be a button somewhere where you can drop the patient's head down, so that way you can start CPR, or it literally just says a CPR button on it. And I noticed that she took the time to lower the bed down, which maybe, it was an older bed or something, but something like that shouldn't have been taking the time to be attended to whenever there were other priorities at stake, such as maintaining his airway.